Hello, and thanks for coming back to my channel. I wanted to start off the day by congratulating the U.S. for winning bronze over the weekend. I'm being sarcastic because it's an easy way to avoid feelings. But the U.S. is now in third place in terms of the total number of cases diagnosed in the world. Um, Interesting little ditty today um, about Jack and Diane. No. Rand Paul's coronavirus infection sends shockwaves through the Senate. Why is it surprising that someone got coronavirus? Thousands and tens of thousands of people are getting coronavirus in this country. Did Republicans think they were somehow immune? I don't understand that. So today I'm going to talk a little bit more about the spread in Europe and the US and some patterns emerging in terms of the rate of spread. I'm going to talk about virulence and the high variability we're seeing in the case fatality ratio. And I'm going to talk a little bit about some false optimism that came out over the last 6 or 8 weeks or 4 weeks. Even 4 weeks ago, we were getting people in the published medical journals and press talking about why we should really worry a lot more about influenza right now because it kills so many more people, and coronavirus is some other problem way off in China. And at the time, we should have known better because there was already pretty good published data that suggested this was going to be a real big challenge. So here we're looking at the number of cases plotted on a log 10 scale. And there's a number of patterns I want to point out for in particular. The first and the most important is Korea. Korea started the month with more cases than any of the European countries or US. And yet they ended the month second lowest. They were able to tame their curve, to flatten it out and stop the accumulation of new cases, which is really important. And we need to look at how they did that. We need to look at how Singapore and Hong Kong and Taiwan have also done that. The Chinese have done that as well, although I question both their methods and their accuracy, their reliability of their reporting of their own data. Italy's had this tremendous growth in number of cases, as we've all heard about. What's important, I want you to understand, though, is that France, Germany, Spain, the US, the UK, we're all growing at the same rate. So that means we're all heading down the same path. They got a few days head start or a few weeks head start, but there's no reason to believe we're not going to end up there in 5 or 7 or 10 days. And that's really important. When I was modeling these things, I wanted to really look to see if we're seeing any signs yet that the social isolation measures and the quarantining that Italy did, whenever that was last week, is starting to show up as in the number of cases starting to decelerate. And so I fit a quadratic model in the log 10 space, blah, blah, blah curvature. Okay, what you find is that there's actually very strong evidence that Italy's epidemic is slowing. The cases are still accumulating, but the rate at which they were increasing is starting to shrink, and we're starting to head toward fewer and fewer new cases each day. This is Italy raw data, real data here, and that line, that quadratic line that I was telling you about. I fit a quadratic to both the US and to Germany, and neither of them were statistically significant in terms of curvature, although Germany was slightly concave down and the US was slightly concave up. So although it's not clear that the evidence is very strong, if anything, Germany might be starting to slow, but the US looks like it's accelerating. So I looked at these predicting lines, and I had data through the 20th because I had downloaded the data yesterday, the full data set. And I predicted that on the 22nd, today, that the U.S. would pass Germany for third place. And sure enough, we did. Now, that's not surprising. I could have cheated and looked at the data today and seen that, but I predicted 31,600 cases would be the crossover point. The U.S. now has about 33,000 cases. Getting a little bit more bold, I'm going to predict that in 3 days, the U.S. is going to pass Italy. So the U.S. is going to keep galloping at this tremendous rate because we instituted our social isolation measures. Some we still haven't in some places, but so recently that it's going to be another 10 or 14 days before we see any impact. So I think in about 3 days, on the 25th, so that's going to be Wednesday, I think, maybe Thursday, we're going to have 80,000-ish cases in this country. I think Wednesday, if I'm being honest, and I think that will overtake Italy for the second most number of cases in the world. And very shortly thereafter, I think we're going to pass China because China has not been accumulating many cases. So it may be that we end the month in the gold. Go USA. So there's some really substantial differences in accumulation. But there's actually a much bigger issue, which is about why does it seem so virulent some places and not the others? So So this is me plotting, instead of the cases now, this is the fatalities, the deaths. Again, it's a log 10 scale, and then we see that even though South Korea started the month with more cases, they had fewer deaths than Italy, and that difference just got more and more extreme. Italy has been accumulating deaths at a horrifying rate, and South Korea did not see that same accumulation. You'll also see that a number of other countries, Spain, France, the US, and the UK, started the month with many fewer cases and many fewer fatalities than Korea. And during this month, so far, we've all passed South Korea with increasing um, fatalities. The only country that hasn't skipped over South Korea is Germany, and it will soon if you look at the slope here. But Germany has managed to keep a much lower fatality rate than the other European countries, and I don't really understand why. So if we look up in the top right here, just looking at all the raw cases in the world and all the number of deaths, we see that 4.2% of diagnosed symptomatic cases have resulted in death. This is called the apparent case fatality ratio, and it's problematic for a lot of reasons because there are issues of undercounting. Asymptomatic cases are not tested enough. There are issues with time delays before death can occur. So those numbers are notoriously unreliable early in the pandemic, although I'm not so sure it's that early anymore. But I wanted to point out that both Italy and Korea had fairly mature epidemics and that they had thousands of cases at the start of March. And Italy now has 4,000 deaths and 47,000 cases, and Korea has 94 deaths. So something happened in Korea that was dramatically different. Even though they had many fewer cases, they also had even fewer deaths per case. They're losing 1.1 individuals per 100 cases versus 8.6. That's about an eightfold difference. That's really huge. Spain and France started the month at about the same place in terms of cases. Spain's grown more quickly and it has a somewhat higher fatality rate. That's not shock. That's not a huge difference. But I want to point out a couple other things. The U.S. numbers are going to be really interesting because the U.S. infection started much later. So we're going to be seeing this time lag where just in the next few days we're going to start seeing, I think, big upswings in the number of fatalities, and this 1.3% is going to climb very quickly to something much higher. But looking at the UK and Germany, again, this is an issue where the UK has had 4,014 cases as of when I downloaded the data, and 178 of them had died. That's 4.4%. Germany had 20,000 cases and 67 fatalities. And Germany had higher numbers earlier, so that shouldn't be a time lag thing. So in Germany versus the UK, South Korea versus Italy, we're seeing what appears to be pretty marked 5 or 10 or 15-fold differences in case fatality ratios. And I don't know if that's medical care, if that's testing, or if that's really differences in virulence, but it's important for us to know because basically, if we take the lowest value here, 0.3, and the highest, 8.6, there's a 25-fold difference between what we see in Germany and what we see next door in Italy. WTF, that's just enormous. We need to figure that out because I want to live in Germany otherwise because they've done something or maybe they got lucky. I don't know. Okay, so early on in this there was some false optimism that kind of makes me cranky. So this is a thing that was published in the Journal of the American Medical Association. They called it an infographic. This was published in late February. So they said, this is a physician and some other authors. As of February 24th, so we know this was published shortly thereafter, in the United States, there were only 14 cases diagnosed in the U.S. itself and 39 repatriated cases. Nobody was critically ill. Nobody had died. Contrast that with 75,000 cases in China and 2,000 deaths. Well, they said, we don't have a problem. We got 14 of our own cases and 39 we imported. But let's look at the flu. We get 29 million ill patients and 13 million physician visits and 280,000 hospitalizations and 16,000 deaths. Think about that. And 105 pediatric influenza-associated deaths. So they said it's such a much bigger deal that we really need instead to focus about the flu. Get the flu vaccine, wash your hands, and worry more about the influenza than COVID-19. Similarly, only as recent as 12 days ago, an infectious disease specialist says this sort of canceling events over the coronavirus is probably a bunch of overkill, and why are we, canceling St. Patty's Day and stuff because we haven't seen that many cases. Well, what I wanted to point out is that we knew more at that time. So this is a piece of that infographic from JAMA, and this is the report from the World Health Organization situation report on the 20th of February, about 4 or 5 days before, because the numbers match fairly well what they reported, although not identically. So at that time, the World Health Organization said that we have 1,000 cases outside of China in 26 countries, and we've seen 8 deaths. 5 had occurred the night before. So this was 5 days or so before this was published in the Journal of American Medical Association. So we're seeing many things here that are troublesome. 26 countries, really? And we shouldn't worry about it? At the same time, in the same report, the World Health Organization themselves said, we don't recommend any specific health measures for travelers. Travel, have fun. Just if you get sick, see somebody and tell them you've traveled. So the question is, should we have known better? Well, again, there's some weird schizophrenia at the World Health Organization. They had produced interim guidelines on the 4th of February, 3 weeks earlier, about managing patients who have COVID-19. And in that, they said a number of things about how to try to protect yourself. But toward the end, they said, and if you happen to be a caregiver and you develop symptoms, this is what you should do. I'm going to read this to you. Notify the receiving medical facility that a symptomatic contact will be arriving. The idea is they're going to meet you outside and shuttle you into a room without having the chance to infect others. So they're already worried about contagion. While traveling to seek care, the patient who is ill should wear a medical mask to keep the germs in, not someone else's out. The contact should avoid taking public transportation to the facility. An ambulance can be called, or the ill contact can be transported in a private vehicle with all of the windows open, if possible. So there's all this, alarm bells going off in my head about, oh my gosh, this is incredibly contagious. Don't get on public transportation. Roll down the windows, and so forth. And then the symptomatic patient should perform respiratory hygiene. They should cough into their sleeve or a tissue and wash their hands and do all those things. And by the way, any surfaces that they've been anywhere near, scrub down with bleach. So the World Health Organization, 3 weeks before they said don't worry about traveling, have also said this is as contagious as all get out and you need to disinfect as all get out. In that same situation report, this is their graph of the date of onset of symptoms. The orange are symptoms for patients showing COVID-19 in China. Green is where the case originated in the reporting country, and gray is under investigation, and purple is some other country. So you could have gotten coronavirus, you might have ended up in Germany, but you may have gotten it in Italy or Iran. But if you notice, we are transitioning from most of the cases being directly tied to China to most of the cases being obtained, being contracted outside of China. All of this green are cases where they got the infection someone other than China. So we're already past the is it in China only stage. There was a paper published January 31st by some Chinese scientists who said in their paper, which is quite good, that they already had shown that there was major spread to other transportation hubs throughout China. And they went on to say, because it's no longer contained within Wuhan, other major Chinese cities are probably sustaining localized outbreaks right now as we speak. Large cities overseas with close transport links to China could also become outbreak epicenters unless substantial public health interventions at both the population and personal level are implemented immediately. January 31st, they said, look out, world, do something now. They said, otherwise, outbreaks in major cities globally could become inevitable. 3 weeks later, 5 weeks later, there are people in the West saying, you should worry about the flu. Did they not do their research? I don't know. This is another paper that was published a couple days before the JAMA infographic about worry about the flu. And it talks about the virulence of this disease and the number of patients that are in critical care, intensive care for 10, 14 days, and that there's very high mortality, particularly through this um, acute respiratory distress syndrome, and particularly in older individuals. So we had both a warning about spread and a warning about virulence before any of those graphics were published. We also have another graphic that was published about case fatality ratios in other diseases. So they're putting here the novel coronavirus at 4% when this was published. I forget when it was. We could follow that link and find out. So they said that's higher than whooping cough, higher than measles, and seasonal flu is way down here at under 0.1%. Okay, so the best statement is that typically seasonal influenza is less than 0.1% in terms of case fatality ratio. The lowest country we've seen apparently so far is Germany at 0.3%. The world is 4.2%. Italy was at 8.6%. So we're talking about 15, 40, 80 times more virulent than the seasonal flu. And it turns out it spreads faster as well than most seasonal flus. So this is something that we really whiffed on as a global community, and we're paying the price quite dearly. So a couple of fun things to end off that sobering talk. The first is something sent to me by my sister once upon a time in algebra class. They're doing exponential functions. Those are actually normal curves, and that has an exponential piece built into it, but whatever. Like, we'll ever use this crap again. They're talking to each other in class. Well, it turns out some of us do. And then another friend of my wife's, looks like she spelled quarantine wrong, sent this to us, and it's the quarantine questions. What am I grateful for today? Who am I checking in on? What am I letting go of that is normally sort of normal? Am I going outside? How am I moving? What beauty can I find or create or invite today? I love that because there's a lot of very scary things going on. So let's think about what can we do to make our life a little bit more beautiful, or to check in on friends and so forth. And of course, since universities are all shut down right now, I thought a quote of a university student from many years ago was apt. This was, Christ, 7 years of college down the drain. Might as well join the fucking Peace Corps. That was spoken by none other than John Plutarski in 1978.